Tooth decay is one of the most common chronic diseases in childhood. So, how do you protect the little ones in your life from that problem? Well, we've got some advice. Dr. Daniel Nash is a dental director, and Keely Hawk is a dental hygienist, both over at RHN. Guys, thank you for being here, and let's talk about the big issues, because by 17, a majority of children have already experienced tooth decay. At what point does that start, Dr. Nash?
It seems like you can start at any time. I mean, we'll see patients as young as 18 months coming in with cavities. And then we also see a lot of it happening with transition times in teeth. So when the first teeth are coming in and the space is closing, they're in early childhood. And then again, as adolescence starts and those permanent teeth start becoming more prevalent.
So as a dental hygienist, when we're talking to parents that are coming in, how soon do we start doing that brushing? Even before the teeth come in? Are we taking care of those gums? What are we doing?
For sure. Even when the child is an infant without teeth, you can get a washcloth on your finger, a warm, wet washcloth on your finger, rub the gums. Once they start getting teeth, you don't really need to use toothpaste right away. Again, a warm washcloth, rub it on the teeth to kind of keep any milk or...
Very good. Are we seeing more and more kids with issues at early ages?
So some of the more recent studies are showing that we are seeing a downward trend in the incidence of cavities, which is good.
Okay.
But the age of 2 to 5 is actually increasing. And so while we're getting an overall decrease, that age group that's starting that much younger is predisposing them to a lot of issues later on, or more severe issues, extensive cavities.
So we've got these issues, but the great thing is it's preventable, and it starts with healthy habits. So when should we schedule that first dental appointment for the kids?
So the first dental visit needs to be either within 6 months after the first tooth comes through, or no later than about age 1. So most kids are going to see their first teeth coming through about age 6, 7 months, usually the lower front teeth. And so as soon as that happens, or if parents have any concerns around that time, great time to get into the dentist.
And the importance of brushing. Do it often and do it the right way. What do you tell the kiddos that sit in the chair?
Well, number one, just to brush their teeth.
Yeah.
I mean, and important in the morning to try to brush after you've had your breakfast. I know some kids eat breakfast at school, so brush before you go to school. And then also make sure you brush right before bed. You know, you don't want to brush right after you eat your meal because you might have a snack later. So make sure you brush the teeth right before you go to sleep.
And also introduce them to flossing too. That was something I remember as a kid. I was like, what? Flossing? That's for adults. No.
Yes,
get them going.
very important. Yes.
Right.
All right, very good. Not only when we're talking about eating those meals, doing some nutritious, some balanced meals, not just going crazy with the sugar.
Right, and I think that's something that everybody tries to incorporate, but if the sweets are going to happen, best to do it with mealtime, when the saliva can protect it. And then, as you said, with the brushing, we want to see parents involved with that and modeling that behavior. So.
Something as parents, we're always like, at what point do we disengage the pacifier or the thumb sucking, because that can cause problems in terms of the dental care? About what age do we need to start going, okay, that's enough?
So usually the cutoff we like to see is about age 3 to 4.
Okay.
Most kids up to that point, it's going to be relatively natural and normal. But after that, as the teeth start developing, the jaw starts developing, that's when we can see issues with crowding or further problems down the road.
And last but not least, sealants. We kind of talked about that during the commercial break. We're seeing more of that right now.
For sure. Yes, the sealant is just a protective covering that can go in the grooves of the teeth. You know, when we're eating our food or our sweets, food and sugar can get caught in those grooves. So the sealants, the goal is to protect those grooves so they don't get cavities. And usually we typically do those on the first molars, the permanent molars.
Very good. Hey, I want you to learn more about RHN Medical and Dental Group. They're over on Ross Street. But take a look at their website when you get an opportunity. If you have any questions, that's rhnmd.com. Thank you guys for being on the show today. Some great tips that we can all use. Coming up next, we have a look at news and weather headlines.